Hello and welcome to my channel. My name is Jazzy RN. I am a remote utilization review nurse for over 9 years. I've worked for 3 different companies, and the goal of my channel is to help nurses pivot from the bedside to remote work. And this company is called Horizon with Blue Cross and Blue Shield. I do want to apologize for getting to you late with this job. It was posted 4 days ago. It's going to be open for 2 more days, so you have until March 27th to apply. Just a little bit about this job. It does have an option to where you can work an 8-hour or 10-hour workday. That is Monday through Friday, and the varying times start from 8 a.m. to 11 p.m. And just a FYI, it is very rare to find a corporate job that offers a 10-hour workday. It basically is always 8 hours. I've only seen 8 hours, but very rarely you'll see a 10-hour workday in a corporate position. So this job, what you bring, the experience education, includes a high school diploma or GED is required. They do prefer a bachelor's degree or relevant experience in lieu of the degree. You must have a minimum of 2 years clinical experience. That's the bedside. It requires a minimum of 2 years experience with healthcare payor experience. Also, RNs are required to work a specified number of weekends and holidays to meet regulatory and accrediting body standards. Requirements may vary based on the department business needs. That basically means your holidays that you're assigned to work in weekends may rotate. You may work maybe one weekend a month. You may rotate the holidays, and it's sometimes based on seniority. One company I worked for, the weekends and holidays were strictly voluntary unless not enough nurses volunteered to work those holidays or weekends. And when that happened, they just basically chose a nurse based on seniority. And you must have an active, unrestricted New Jersey license, RN license, or active compact license is required. And they do prefer a CCM certification. The next job is a RN2 primary nurse care. This is a case manager remote role. It is full-time. It was posted today. The end date is you have 7 days left to apply. That is April 1st, 2026. Now, this job has similar requirements. You must have a high school diploma or GED. A bachelor's degree is preferred or relevant experience in lieu of degree. It requires a minimum of 2 years clinical experience. Experience with both acute and chronic conditions is preferred. Requires a minimum of 3 years experience in healthcare delivery system or industry. Experience with healthcare payor experience strongly preferred. Also, they want you to have an active, unrestricted RN license required, a New Jersey license required, and or a compact license. And they do require you to have a valid driver's license and insurance. Now, just a FYI, some case manager positions are not strictly remote. Some of them actually are field work. So for this job, it looks like you will be doing a little bit of travel. So travel is primarily within the state of New Jersey, which may be required, and occasional travel in the tri-state area may also be required. Jan Health is hiring a clinical care RN lead. Now, this position is remote, but it is within 30 minutes of New Lenox, Illinois. Now, more part of the job description, it does state you must be in certain time zones. But we're going to focus on right here where it says location, remote within 30 minutes of New Lenox, Illinois. So this is a full-time role. The hours are 8:30 a.m. to 5 p.m. We're going to go straight to the qualifications. You must have 2+ years of experience in a clinical or care coordination role. That can be primary care, chronic care management, home health, etc. RNs with a current license. Strong critical thinking and problem-solving skills in a fast-paced environment, ability to independently manage a digital patient panel and prioritize escalations effectively, excellent written communication and documentation skills, comfort using EMRs, that is electronic medical records. Make sure you also put the platforms on your resume. So just put platform, and if you know Cerner, Epic, Meditech, Protouch, Microsoft Office, Microsoft Suite, Microsoft 365. You want to use the exact same verbiage that the job description has. Comfort using EMRs, care coordination platforms, and digital messaging tools. And that is digital messaging tools is Microsoft Teams or Zoom. Knowledge of Medicare, CCM, or APCM programs is a plus. That's not mandatory. Bilingual Spanish is a bonus but not required. Must be located within the continental United States and have access to reliable internet and ability to work in a specified time zone, either Central, CST, Eastern, EST, or Pacific, PST, depending on client and candidate location and access to internet 5G. Now, just a FYI, this is full-time. It is Monday through Friday, 8:30 a.m. to 5 p.m. It's a flexible remote schedule across CST, EST, or PST time zones. So even if you don't live within that area of Illinois, I would just say apply anyway. It never hurts. 1 hour lunch break, daily huddles with manager or team, and ongoing support from a multidisciplinary care team. Ascension has 4 jobs available for remote nurses. This first one is of AVP nursing practice. It is full-time remote and is a day shift job. And it says location remote. We're going to go straight to the requirements. And for this position, they want an RN that's obtained prior to hire date or job transfer date is required. Education is Master of Science in Nursing required, and 7 years of applicable cumulative job-specific experience is required, with 4 of those years being in leadership or management. Certification in area of nursing practice is preferred, and they're also seeking someone who is a leader. On to the next job is a registered nurse utilization review. This is part-time, it is remote, and it's a day shift job. As you can see here, it is days, part-time. The salary range is $78,000 to $110,000 per year. And the requirements for this job: you must be a licensed registered nurse, credentialed from the Texas Board of Nursing, or current home state license from multi-state license recognition, which is compact state, obtained prior to hire date or job transfer dates required. And education is a diploma from an accredited school or college of nursing, or a required professional licensure at time of hire. And if you have any of these additional preferences, that includes a clinical licensure that is active and unrestricted, registered nurse license, or equivalent clinical credential required for medical necessity determination, compact or Texas state license required. Utilization management expertise, proven experience in applying medical necessity criteria such as interqual or Milliman, that is MCG as well, within a clinical or payor environment, and must have bedside nursing experience. The next job is Director of Nursing Practice. This is full-time. It is remote and day shift. I do see it here. It says Batesville, Indiana. So this job salary range is $129,000 to $183,000, and it is also eligible for annual bonus incentive. On to the requirements. You must be a registered nurse obtained prior to hire date or job transfer date required. A BLS is provider obtained within 1 month or 30 days of hire date or job transfer days required. American Heart Association or American Red Cross is accepted, and they do require you to have a master's degree in nursing. The additional preferences they're looking for is a clinical nurse specialist with system experience is strongly preferred, and a doctoral degree. This keeps popping up. A doctoral degree, DNP, or PhD is preferred. And the last job is a Chief Nursing Officer Ascension Living. This is remote, it is full-time, and it's a day shift job. Now this job is actually remote with travel, and the salary is $193,000 to $260,000 per year. This position is also eligible for participation in annual bonus program. And the requirements for this job is registered nurse obtained prior to hire date or job transfer date is required. A bachelor's degree in nursing or diploma from an accredited school or college of nursing is required. A master's degree or a combination of bachelor's degree and experience is preferred. Your work experience must be 5 years of experience is required, or 10 years of experience is preferred. 2 years of leadership or management experience is required, and 5 years of leadership or management experience is preferred. And additional preferences include skilled nursing facility, that's SNF experience, and experience managing multiple sites, and that's a minimum of 5 to 10 sites.